Young teens could soon be next in line for the COVID-19 vaccine. Good evening and thank you for joining us. I'm Kimberly Parker.
And I'm Rebecca Brumfield. This week, the FDA announcing the Pfizer vaccine now authorized for emergency use in 12 to 15-year-olds. Demetrius Sanders shows us how this is a major step toward ending the pandemic. Demetrius.
Well, Rebecca, Kimberly, doctors and school officials I spoke to all shared excitement that vaccine eligibility is heading towards expanding. And some say it will lead to normalcy for children that has been absent for more than a year. While less likely than adults, doctors say younger age groups can still feel the effects of COVID-19.
The infection that kids get with COVID generally is mild. Generally, but not everybody.
Pediatrician Nora Philbin says in some cases the virus having a lasting impact on young ones.
We've had quite a few teenagers and adolescents who've actually gotten very ill and have had the long haul COVID.
But with the FDA's authorization of the Pfizer BioNTech vaccine for use in 12 to 15-year-olds, health providers may soon have a new tool at hand to fight the pandemic.
Every time we open up a new rung of individuals that can get vaccination, we start to see much more urgency to get that vaccination.
As for what it could mean for schools, the superintendent of Peoria Public Schools says a more normal education experience, from not having to quarantine due to being a close contact to being able to further enjoy extracurricular activities.
They can participate, for example, in summer camps, in summer activities, and other events in the next few months. And they don't really have to worry about anything.
And doctors explain as families make decisions on vaccinations that communication will play a big part.
Educate yourself on the clinical trials, educate yourself on what the experts are seeing so that you can, again, come together as a family.
Now, Overton tells me that OSF Healthcare has earmarked Pfizer vaccine for younger groups and they don't anticipate any shortages. Karat says that PPS will work with medical professionals to make shots as accessible as possible. Rebecca?